The side effects of insulin. Your body creates insulin in your pancreas. Insulin is a hormone that enables the cells of your body to get the energy they need by absorbing sugar in the form of glucose from the bloodstream. Insulin is often referred to as the storage hormone for good reason. When you are insensitive to your own insulin, or when your body can't produce enough insulin, you have to inject it so that your body can absorb the sugar it needs from your bloodstream. Are you about to inject insulin? If so, you should know about the possible side effects of this medication. In this video, I highlight the 10 most common and dangerous side effects of insulin. I'll also show you what you can do to reduce the amount of medication you use. Number 1. Weight gain. You're probably not expecting this, but insulin can increase your weight by around 15 kilograms. That's 35 pounds. Mind you, chances are you were already slightly overweight. Why? Because, as I've already mentioned, insulin is the storage hormone. And that's where the problem lies. As soon as you start injecting more insulin, the body stores more nutrients in the form of fat. 2. Hungry. When you inject insulin, you risk two things. One is that you inject too much, and the other is that the insulin does its job too well, which can result in hypoglycemia, meaning your blood sugar drops below the normal level. As soon as this happens, your brain sends out a hunger signal to encourage you to eat. This way, your body can boost your blood sugar level. Type 2 diabetes patients are well known to suffer from bouts of binge eating, usually as a result of injecting too much insulin. 3. Shaking and trembling. When you have low blood sugar levels from injecting too much insulin, your body starts producing counter-regulating hormones such as adrenaline and cortisol. These hormones force your liver to release sugar in the form of glucose in order to restore your blood sugar level. These hormones also make you shake and tremble. 4. Fatigue. A high blood sugar level is not good, but, surprising as it may seem, low blood sugar is much more dangerous. One side effect of injecting insulin is extreme tiredness. This happens when your blood sugar level drops too far below normal. Low blood sugar means low energy. 5. Dizziness. Apart from feeling tired, your mind can get a little foggy too. This is because the low blood sugar level is preventing the brain from getting the energy-giving glucose it needs. The energy shortage in your brain makes you feel dizzy. This and other unusual mental phenomena are common side effects of insulin. Number 6. Changing mood. Mood swings are another common mental side effect of low blood sugar. Not only are you in a bad mood, but it could easily be affecting those around you as well. If you've recently found yourself losing your temper over silly little things, it's quite possible that you're injecting too much insulin. Constantly changing blood sugar levels can have a big influence on your moods. Lowering the amount of insulin you inject might solve this problem. Number 7. Hyperglycemia. Another risk with insulin is that you don't inject enough, which would result in the typical diabetes symptoms that you might already be familiar with. Peeing a lot, drinking a lot, a dry mouth and tongue, fatigue, drowsiness. These are symptoms of high blood sugar and happen when there is not enough insulin available in your blood. Number 8. Hypersensitivity. If you are hypersensitive to insulin, you may get allergic reactions in your body. Decades ago, this side effect was much more common because we used to use insulin from animals. Today, we can produce human insulin in factories, so the side effect is much less common. Yet, it can still happen, and that's why it's vital to call a doctor if you experience anything that resembles an allergic reaction. Otherwise, there could be serious consequences, even death. Number 9. Injection marks. When you inject insulin in the same spot over and over again, so-called injection marks can develop. These marks turn into hard nodules or hard spots on the skin. To prevent the marks from developing, avoid injecting insulin in the same spot every time. Injecting too often into these hard spots hinders insulin absorption and renders the effect of the injections much less reliable. Number 10. Blurred vision. Though very annoying, blurred vision is not an indication of permanent damage to your eyesight. It is simply a temporary symptom of fluctuations in your blood sugar levels. If your blood sugar level fluctuates a lot, the blurriness of your eyes will change along with it. Fluctuating blood sugar levels can affect the refractive index of your eye, causing the light to fall slightly differently on your retina, and thus temporarily blurring your vision. Your eyes normally adjust fairly quickly, but if it keeps on happening, it's to modify your insulin dosage accordingly.